Hello and welcome to the CPCW monthly update for pharmacy contractors and their teams for February 2022. These updates we do monthly on or around the first Tuesday of every month, and there's a YouTube playlist which always has the latest one on the top. That appears in our newsletter, so please look out for it and subscribe if you find it useful and if you want that appearing at the top of your feed. Got a few topics today. First of all, we're going to cover the hypertension event. Depending when you watch this, it's either happened or it's due to happen imminently. But on Tuesday the 1st of February, we've got a hypertension event at 7:30. This really is designed to show off the local elements of the hypertension case finding service, as well as some sneak peeks at some of the farm outcomes modules that will be available for you and your teams to be able to record the service, record the provisions, and to help you guide you through. We will also have a little bit around the referrals in. First, the service that's being put in place in terms from referrals being received from EMIS practices, but also the ability for NHS referrals received from NHS mail referrals received from other practices to be entered directly onto the module. And there'll be a demo of that tonight. All of that will be recorded and be on YouTube, and that we'll distribute that through our newsletters. So if you haven't got it, please have a look out for it on the newsletter and you can read that through. Next thing round was around the Psnc advice audit and the pressures survey. The advice audit is live right now, and it'll run for a period of 3 weeks. It went live on the 31st of January, so we got just over 3 weeks at the time of recording, just under 3 weeks at the time of recording to fill that in. We're going to be amplifying this, so you'll hear lots about it through all of our comms channels, through our newsletters, and indeed that's what this is now. Just the reason we're doing that is it is important. It's bringing data and evidence into negotiations. As a sector, we don't by default capture a lot of the really good activity that occurs in pharmacy, and what we're doing is that we're looking for evidence on both the cost of doing that and the activity that the Psnc can then use in negotiations. The response rate for that is critical, so any encouragement that we can offer to contractors to fill that in is appreciated. Last time round, I think across England we had just over 10,000 responses to the first one. We had just over 6,000 to the second one, and having that position that we can say the majority of contractors have fed in and fed information into that audit is massively important. It's really unheard of to have that sort of response rate, and it speaks hugely to the level of importance it has for all of our sector. In terms of that preamble, it's good for going into the year 4 negotiations. We're doing it around the same time as year as we've done previously, and the feedback we're getting in from our contractors and Psnc are getting direct is massively weighed around capacity. So evidence needs to demonstrate that so that Psnc can then use that to have the conversations around money and resources to support that capacity constraint. It's, as I say, really important, and I would encourage you to do it. Just a few things that have happened since the last one. There's some really good PR elements of it. So in terms of the COVID cost bid that Psnc went through, all the MPs, or almost all the MPs that stood up in that debate, just over 10 of them, they quoted numbers directly from our advice audit. So it does land, it does get the information across. One new nuance that's been brought in this time round is we're trying to look at the complexity of patients that are coming in. The narrative, and certainly the evidence I've seen when I've been in pharmacies, is the cases are getting more complex that are coming into us because they're being displaced from elsewhere in the system. They can't get in to their GP, or they're leaving it longer to seek help. And really, we need evidence of that. We need to capture that to prove that the right consideration is being done. The way that it's being measured, there's a question in the audit around thinking about the pharmacist thinking about the urgency of referrals they escalate elsewhere and using that as a barometer. So I'd really encourage you to give proper thought and consideration to that question when you're answering it, and that's why it's important, is because that's what it's being used to do. The early feedback we've had from those that have seen it, we've captured a few conversations, have been really positive. Contractors feeling that what they do in that audit makes a difference to expressing their situation, expressing their view, and hopefully that's the case. I'd be really interested to hear what you think about it, and hopefully we can get the right result as a result of it. The other thing I wanted to draw attention to is there's a pharmacy pressures survey, and those those information from that and the quotes from that will help inform Psnc on the scale of the problems out there. There's 2 different surveys to fill in. One is for your teams and one is for contractors and head office representatives. I'd really encourage you to do that and to distribute it round. I think in the preamble to it, it says it takes about 15 minutes. I did it after my last shift in a pharmacy and it's more like 10. And it's, if you're looking for it, I'll put a link in the description for the YouTube videos for those watching through that medium. It was also a link in our newsletter this week. So if you're struggling to find it, again, drop us a message for our support inbox and we'll make sure that's out to you. Another couple of things to tell you about, first of which is the GP CPCS. So this is general practice referring to our consultation service. We're doing a series of events or webinars covering that. We're going to be looking at referral pathways, the timescales involved, how you handle escalations. We're going to be offering some tips on how you involve that whole team in the service. And we're also going to be looking at patient safety, patient experience, and the completion of the referrals and the funding. There's 3 of these webinars going through. They were in the newsletter last week and we'll put in the description. The first one is on the 16th of February at 7 p.m. The second one is in the daytime, so it's the 17th of February at 1 p.m. and the last one is on the 1st of March, again at 7 p.m. in the evening. They're being run by Sarah, who's our engagement officer, and hopefully you'll value them. Anyone involved in doing the CPCS service, I'd really encourage them, not just a contractor-specific thing, it's for the whole team. And they should be a great help of practically delivering that service in your pharmacies. Few things to update you on around a couple of services. So the smoking cessation advanced service, there's no massive updates or news on the timings. The one thing that's been shared to us by the services team is that it's likely we will get the specification launched in the upcoming weeks. It's in quite a good place. They're almost finalised. However, Psnc's team have said they're being quite firm that the IT solutions to support such referrals landing in pharmacies from hospitals, they need to be in place first before the launch. So it's likely we will actually get the specification to mull over, to look at and to plan around before we start receiving the referrals coming in. So we should get a bit of time and prep hopefully on that one. The other element is around the discharge medicine service. This is an essential service, as you know. And there's been some positive news on that, in that there's been some incentives added to the hospital contract. They're called sequins. They've been inserted nationally. And what that means for us is it gives us a little bit more leverage or persuasion to encourage hospitals to start sending more referrals, or start sending referrals in some cases. And when they do so, is to make sure they're compliant with the national data set. So hopefully that should mean if you're not receiving referrals, there's more likelihood of receiving them more soon, and also that the referrals you get, there should be less queries, particularly on stage 1 of the service, because I know there's a number of stocked medications that we're seeing across our patch that aren't getting onto the data set that we're receiving, and they should be. So we've already had that conversation, and that sequin target being inserted nationwide has been really helpful for us to pitch that. And indeed, it's moved it on, particularly for those contractors on the Wirral with Arrow Park, and they've really taken it to heart, and we're going to be working through how we get the stop-start data on there. A couple of other things just to draw attention to. The provisional registration, those registered on that provisional register with the GPHC, that closed on the 31st of January, so yesterday, as at the point of filming. So please just check any registrants who were on there, check they're managing the process properly. There's no automatic transfer. The GPHC have contacted candidates who've not yet passed that exam directly, but just a plea to everyone just to check that people don't fall foul of that. Few other things. Our website is undergoing an upgrade. Alison on the team's working really hard to make sure that we get all of the right materials and we get the setup right. It's due to go live, subject to the agency that Psnc have got working on it. It's due to go live on Thursday of this week, and we'd be really appreciative of any feedback. If it's working for you, can you find what you needed to easily? Or if you find any broken links, let us know, because there's bound to be a few things that slip through that aren't working quite how we would want them to. But any feedback, please pass through to us at support@cpcw.org.uk. And then the last one I wanted to mention tonight, this is for contractors in Warrington. There's some mandatory training for supervised consumption on Thursday of this week. It's a repeat from the December event that they ran, so if you've got to attend one of them. So if you've already attended it in December, you don't need to attend this one. However, if you didn't attend it in December, if you want to carry on offering the service, you have to do it. So if you've not already received that link directly, contact us as a matter of urgency. It has been in our last few newsletters. It's towards the bottom and it does say for Warrington contractors only, but please look out for that. Otherwise, that's it for the monthly update for this month. If there's anything you'd like us to particularly cover, then please let us know. Either comment in the section below or contact us through at support@cpcw.org.uk. Thank you, and we'll see you next month.